Good evening, everyone. So let's crack NEET PG 2021 and myself, Dr. Apoorva Mittal, and I'm your mentor for anesthesia on this prestigious platform for Unacademy. And today we'll discuss a very important topic, that is pseudo and pseudo hypoparathyroidism. When we listen to this term, that is pseudo and pseudo hypoparathyroidism, we get confused ki what will be the answer and how will be the questions asked. So after attending this lecture, I'm pretty sure that you'll be able to answer all the questions related to the hypoparathyroidism and also on pseudo and pseudo hypoparathyroidism. जितना डिफिकल्ट द टर्मिनोलॉजी लगती है उतना ही इजी कंसेप्ट है एंड वंस यू अंडरस्टैंड द कंसेप्ट you will be easily able to answer the questions. And my referral code is Apoorva Live, APOORVA Live. Use this referral code to get 10% discount on the Plus and the Iconic subscriptions. Before starting our today's topic, let me introduce you Unacademy. Unacademy is India's leading platform for all the online courses. And how can you benefit from Unacademy? You can install the Unacademy Learning app. And by installing the Unacademy Learning app, you will be able to avail all the live classes, live tests and quizzes, live doubt clearing sessions, right? So by just installing the app, you will have those advantages. But also I would advise you to get the Plus and the Iconic subscription. Now, what are the advantages of the Plus subscription are? By getting the Plus subscription, you will be able to avail the live classes, the live test and quizzes, okay? And we have batch courses and the structured schedule. On the YouTube, you might forget to attend some of the topics, but through the Plus Icon subscription, we have those batch courses and which will cover all the 19 subjects and will really help you for cracking the exams. And the Iconic subscription, how is it better than the Plus subscription? Along with the advantages of the Plus subscription, in the Iconic subscription, we are associated with Prep Ladder, and you will have the video lectures, the question bank, okay, in which the questions which has been asked earlier or can be asked, the probable questions are included, and those has been put by the top educators. The rapid revision course, friends, revision is really necessary for you to crack any exam, and also handwritten notes. So these are this is the importance of the Iconic subscription. Now, if you're planning to give the next 2022, okay, I would advise you to go for the Iconic subscription. It will really help you out. So that subscription we have for 1 year, or if you are still in the third year or the fourth year of MBBS, you can avail it for 2 years and 3 years. What is the advantage? You will have revision numerous number of time, and it will make your concepts better and clear, which will help you to crack the exams. Okay, and if you apply my code, that is Apoorva Live, APOORVA Live, you will get an awesome 10% discount. Now, coming to the Plus subscription, the advantage is we have even a 1 month subscription and the 3 month subscription. Now, if you're applying for this year exam, which is in April, okay, so you can always get the subscription for 3 months or a 1 month, so that you have rapid revision course with the top educators of India. And here also, if you apply my code Apoorva Live, you will get an awesome 10% discount. So let's start our today's topic, that is pseudo and pseudo hypoparathyroidism. Now, before starting our today's topic, first let me tell you how the parathyroid hormone, okay, it regulates the calcium, phosphate and the vitamin D levels in our body. Okay, what is the role of the parathyroid hormone in all these things? And then the first we'll discuss hypoparathyroidism, उसका mechanism देखेंगे, फिर we will go to the pseudo and pseudo. Now, ये जो पैराथायराइड हार्मोन है, ओके, द पैराथायराइड हार्मोन, इट इज सिक्रेटेड बाय द चीफ सेल्स, ओके, ऑफ द parathyroid gland. Okay, now where this parathyroid gland is present, as you all know, it is 4 in number. Okay, 4 in number, and it is present just behind the thyroid gland. Okay, so the parathyroid hormone, it can be asked, it is secreted by the chief cells of the parathyroid gland, which is 4 in number, which is present just beneath the thyroid gland. Now, relating to the calcium, okay, so this parathyroid hormone is responsible for the regulation of calcium first. ठीक है, तो सबसे पहले कैल्शियम तो कैसे रेगुलेट करता है, इट बिकॉज ऑफ इट्स एक्शन ऑन द बोन, ठीक है, किडनी और इंटेस्टाइन. नाउ पहले देखेंगे कि ये बोन के ऊपर कैसे एक्ट करता है. दिस इज वेरी वेरी इंपॉर्टेंट, दिस इज वेरी वेरी इंपॉर्टेंट. We all know that parathyroid hormone, ठीक है, उसकी वजह से calcium level increases. Now how the calcium level increases, that we'll study, that is on the bone. तो क्या होता है, whenever the calcium level it decreases, whenever the calcium level decreases, mind me, I'm talking about the ionic calcium levels. Okay, whenever the unionized, okay, or the ionic calcium ions, it decreases in the blood, what it does, it is sensed by the calcium sensing receptors. Now where these calcium sensing receptors are present, these are present on the parathyroid gland. तो बॉडी में, ब्लड में अनआयनाइज्ड कैल्शियम कम हुआ, द आयनिक कैल्शियम इट डिक्रीजेस. उसकी वजह से क्या हुआ, एक सिग्नल पास हुआ पैराथायरॉयड ग्लैंड में, किसके थ्रू, बाय द कैल्शियम सेंसिंग रिसेप्टर्स विच आर प्रेजेंट. सो दिस इज वन ऑफ द एमसीक्यू क्वेश्चन. नाउ पैराथायरॉयड ग्लैंड ने ये सेंस किया और उसने क्या किया, पैराथायरॉयड हार्मोन सिक्रीट किया. अब हमें पता है कि जो पैराथायरॉयड हार्मोन है वो बोन्स के ऊपर एक्ट करता है और उसकी वजह से कैल्शियम को रिलीज करता है ब्लड में. नाउ अनदर इम्पॉर्टेंट क्वेश्चन दैट कैन बी आस्क्ड इज, ये जो पैराथायरॉयड हार्मोन है ये किसके ऊपर एक्ट करता है. So remember the parathyroid hormone, okay, the receptor for the action of the parathyroid hormone is present on the osteoblast, which is actually the bone forming cells. Please remember, ये जो receptor है for the action of the parathyroid hormone, it is not present on the osteoclast. In fact, it is present on the osteoblast. Now you will say कि अगर ये osteoblast के ऊपर है तो इससे तो bone को produce होना चाहिए, तो इसमें से osteoclastic activity से कैल्शियम कैसे रिलीज हो रहा है. So it has a direct, okay, receptor on the osteoblast but indirect action on the osteoclastic cells. ठीक है, so the parathyroid hormone, its receptor, okay, it is present on the osteoblast. So whenever the calcium level it decreases, parathyroid hormone it is released, okay, it is released, and through its receptor, that is the rank receptor, okay, the rank, okay, the rank, it will go and bind to the receptor activation tumor necrosis factor kappa. ठीक है, वो क्या करेगा, it will go and bind to the rank ligand, which is where it is present on the osteoblast. उसकी वजह से क्या हुआ, the GS alpha, which is the G protein stimulatory, ठीक है, stimulatory in nature, वो that gets activated. ठीक है, तो parathyroid hormone, it acts on where, it acts on the receptors. Where the receptor is present, remember it is present on the osteoblast. Very very important point. Now once it acts on the receptor, what will happen, the GS alpha, which is stimulatory in nature, it gets activated. Now when it gets activated, because it is stimulatory, तो क्या होगा, it activates the adenyl cyclase. ठीक है, adenyl cyclase की वजह से the ATP is converted into the cyclic AMP, which forms the protein kinases. And what is this protein kinases? That is the bone forming protein is formed. Then how is it releasing the calcium? ठीक है, adenyl cyclase से तो क्या हो रहा है, the bone forming protein is formed. तो एक्चुअली में तो बोन फॉर्म होना था, है ना, calcium would have been utilized, but this also has an activity on the osteoclast forming factors. ठीक है, तो ये जो osteoclast forming factors होता है, that is the one, okay, which forms the osteoclast, okay, which aggregate together and forms the osteoclast, and from there the bone resorption takes place, ठीक है, तो ये जो GS अल्फा है डायरेक्टली ऑस्टियोक्लास्ट फॉर्मिंग फैक्टर्स बनते हैं, which are what? Another important MCQ, these osteoclast forming factors are monocytes. They are monocytes and these aggregate together और multinuclear self produce करता है, that is the osteoclast, जिसमें से bone resorption होता है and calcium, the ionic calcium is released into the blood. Is it clear? ठीक है, तो दिस इज व्हाट हैपेंस नॉर्मली, कि जब कैल्शियम लेवल डिक्रीज होगा पैराथायरॉयड हार्मोन को रिलीज होना चाहिए, which should act on this receptor, that is the GS alpha receptor. It will, because of the transcription and translation, because of the translation, what will happen? The protein will be formed, the protein kinases will be formed, and therefore the bone forming proteins are formed. ठीक है, now that was on the bone. अब किडनी में क्या होता है? ठीक है, किडनी में जो पैराथायरॉयड हार्मोन है, ठीक है, किडनी में जो पैराथायरॉयड हार्मोन है, इट कॉजेस द कैल्शियम, सॉरी, नॉर्मली, ठीक है, नॉर्मली क्या होता है, किडनी में द कैल्शियम इज रीअब्सॉर्ब फ्रॉम द होल ऑफ द ट्यूब्यूल, ठीक है, एंड मैक्सिमम 60 to 70% अकर्स फ्रॉम द प्रॉक्सिमल कॉन्वोल्यूटेड ट्यूब्यूल, ठीक है, 60 to 70% इट हैपेंस फ्रॉम द प्रॉक्सिमल कॉन्वोल्यूटेड ट्यूब्यूल. मगर जो ये पैराथायरॉयड है, क्वेश्चन, अनदर इंपॉर्टेंट क्वेश्चन, द पैराथायरॉयड, this what it does, it causes resorption of the calcium from only the distal tubules and the collecting duct. और ये जो एक्शन है पैराथायरॉयड का, distal tubules and the collecting duct, because of that the calcium is being reabsorbed, ठीक है, तो it causes reabsorption of the calcium, therefore it will increase in the blood, ठीक है, by acting where? On the collecting ducts and the distal tubule. Also, one more thing is, ये जो पैराथायरॉयड हार्मोन है, कैल्शियम का तो रीअब्सॉर्प्शन इंक्रीज कर रहा है, बट इट इनहिबिट्स द रीअब्सॉर्प्शन ऑफ फॉस्फेट, ठीक है, बिकॉज इट इनहिबिट्स द रीअब्सॉर्प्शन ऑफ फॉस्फेट, तो क्या होगा, ब्लड के अंदर फॉस्फेट क्या होगा, कम होगा. बिकॉज ऑफ दैट ये जो फॉस्फेट, ओके, इट फॉर्म्स एन इनसॉल्युबल सॉल्ट विथ कैल्शियम. तो अगर फॉस्फेट कम होगा तो जो कैल्शियम के साथ ये इनसॉल्युबल सॉल्ट बना रहा है वो भी कम हो जाएगा, तो फ्री या फिर अनआयनाइज्ड कैल्शियम इट विल इंक्रीज, ठीक है, सो इट इनडायरेक्टली इंक्रीजेस द अनआयनाइज्ड कैल्शियम, and as it decreases the resorption of phosphate, what happens, the phosphate, ठीक है, it is excreted via kidney, and remember, therefore parathyroid hormone is also known as phosphate trashing, okay, it is also known as phosphate trashing hormone, ठीक है, another important point. तो क्या क्या पढ़ा हम लोगों ने, कैल्शियम के ऊपर पढ़ा, फॉस्फेट के ऊपर पढ़ा, अब विटामिन डी. ये क्या करता है, पैराथायरॉयड हार्मोन जो है, इट स्टिमुलेट्स, ठीक है, इट स्टिमुलेट्स द कन्वर्जन ऑफ द inactive vitamin D to active vitamin D, that is, it stimulates the conversion of 25 hydroxy vitamin D to 125 hydroxy vitamin D, and therefore ये जो होता है एक्टिव विटामिन डी, ये कैल्शियम का अपटेक फ्रॉम द इंटेस्टाइन इट विल इंक्रीज, तो इंटेस्टाइन से कैल्शियम और फॉस्फेट, ठीक है, रिमेंबर कैल्शियम और फॉस्फेट दोनों ही ब्लड की तरफ आएगा, ठीक है, एंड देयरफॉर द अनआयनाइज्ड और द आयोनिक कैल्शियम इट इंक्रीजेस इन द ब्लड. तो पैराथायरॉयड हार्मोन इट इज इंक्रीजिंग द अनआयनाइज्ड कैल्शियम इन 3 ways. सबसे पहले बोन, ऑस्टियोक्लास्ट के ऊपर एक्ट करके, ठीक है, बट द रिसेप्टर रिमेंबर इज प्रेजेंट ऑन द ऑस्टियोब्लास्ट, ठीक है, देन द किडनी, ठीक है, the resorption from the distal convoluted tubule and the collecting ducts, that's why. And because of the active vitamin D, because of the calcibine, what it does is it stimulates the calcium uptake from the intestine. Okay, that was about the calcium. Now regulation of serum phosphate, as I told you, parathyroid क्या करता है, it reduces the resorption of phosphate from the proximal tubule of the kidney. तो क्या होगा, more phosphate is present where, in the renal tubules, it is present in the renal tubules, and what will happen, it will be excreted, and therefore it is known as the phosphate trashing hormone. But it also enhances the uptake of phosphate from intestine and bone, but that is less. ठीक है, ये जो decrease in the resorption है, that is more, ultimately it is excreted out into the urine. ठीक है, अभी तक समझ में आया? ओके, और विटामिन डी का क्या था कि 1 डिहाइड्रोक्सी कैल्सिफेरॉल इज कन्वर्टेड डाइहाइड्रोक्सी 25 hydroxy vitamin D is converted into 125 dihydroxy vitamin D, and that causes the uptake of the calcium from the intestine, and therefore it increases. Okay, this is normal. Now, what happens in hypoparathyroidism? Okay, hypoparathyroidism में क्या होगा? The parathyroid hormone will be less. अगर पैराथायरॉयड हार्मोन लेस होगा तो क्या होगा, उसकी वजह से द अनआयनाइज्ड कैल्शियम, ठीक है, द आयनिक फॉर्म ऑफ द कैल्शियम, इट विल बी आल्सो लेस, and what will ultimately happen to the phosphate, it will increase if the renal function is good. Okay, if the renal function is good. So this is what is happening. Okay, I'm so sorry. हाँ, तो पैराथायरॉयड हार्मोन अगर कम होगा तो कैल्शियम भी कम होगा, ठीक है, एंड ऑल्सो द फॉस्फेट, इट शुड ऑल्सो डिक्रीज. ओके, इट शुड ऑल्सो it will increase. Okay, it will increase because the resorption, because the resorption from the kidney will be increased, क्योंकि पैराथायरॉयड हार्मोन कम है तो फॉस्फेट will increase. ठीक है, now, ठीक है, इतना समझ में आया? पैराथायरॉयड कम है, अल्टीमेटली कैल्शियम विल बी डिक्रीज, बट द फॉस्फेट अल्टीमेटली विल बी इंक्रीज बिकॉज मोर विल बी रीअब्सॉर्ब्ड. ठीक है, रीअब्सॉर्ब फ्रॉम किडनी. ठीक है, सो व्हाट कैन बी द कॉजेस? सो इट कैन बी आर्ट्रोजेनिक. हाइपोपैराथायरॉयडिज्म इट कैन बी आर्ट्रोजेनिक. तब मोस्टली हम लोग देखते हैं कि जब थायराइड सर्जरी की जाती है, बाय चांस समटाइम्स द पैराथायरॉयड ग्लैंड इज आल्सो रिमूव्ड. ठीक है, सो दैट कैन लीड टू हाइपोपैराथायरॉयडिज्म. ओके, और इट कैन बी बिकॉज ऑफ autoimmune disease. There is destruction of the parathyroid gland because of the autoimmune disease, or because of the DiGeorge syndrome. Because of the DiGeorge syndrome, इसके अंदर क्या होता है? There is thymus aplasia and also parathyroid gland aplasia. Because of the thyroid gland aplasia, what happens? ठीक है, उसकी वजह से क्या होगा? The cell mediated immunity, ठीक है, the cell mediated immunity, it decreases and parathyroid की वजह से, ठीक है, पैराथायरॉयड ग्लैंड की वजह से द पैराथायरॉयड हार्मोन इट डिक्रीजेस. So DiGeorge syndrome is this, and remember it is because of the problem in which chromosome, that is 22, which part, that is 22q, the long arm. Okay, the long arm of the 22 chromosome. ठीक है, so as I told you, less parathyroid, less ionized calcium. तो कैल्शियम जब कम होगा, when the calcium is less, what will be the clinical manifestations? It will result in tetany, ठीक है, there will be Shofstek sign. Now what is Shofstek sign? Whenever we are giving the impulse on the facial nerve, ठीक है, whenever we are tapping the facial nerve, there will be twitching of the face, and that is what is known as the Shofstek sign, and that is what we see in case of hypocalcemia. या फिर Trocheus sign. What is Trocheus sign? The BP cuff, ठीक है, BP cuff को inflate करते हैं. So this hand, okay, it will be what? It will be pronated, and there will hyperextension of this metacarpal and interference. So they will result in the Trocheus sign. Okay, this is the Trocheus sign. So Shoftic sign, Trocheus sign, tetany. And if it is severe hypocalcemia, that can result in stridor. Okay, and that will result in the stridor or laryngospasm, perioral paresthesias. Okay, there will be prolonged QRS complex on the ECG, and exaggerated reflexes, the exaggerated deep tendon reflexes. That is because the muscle, the membrane, okay, it becomes hyper excitable because of the decrease in the calcium level. So these are the symptoms which the patient will have, will present with the signs and symptoms, okay, because of the decrease in the parathyroid hormone. Now whenever we are seeing this, the arrhythmias we are seeing, okay, या फिर we are seeing the seizures, the first line of treatment will be what? That will be IV calcium gluconate. कैल्शियम की कमी से हो रहा है एकदम से, IV calcium gluconate, and also in cases of the acute cases. ठीक है, chronic cases में we can even give the oral calcium supplements 1 to 2 gram per day. Vitamin D supplements, why? Because it will increase the uptake of calcium from the intestine, that's why. And also the analog of the parathyroid hormone, which is known as teriparatide. So remember, teriparatide can be given for the treatment of hypoparathyroidism. हाइपोपैराथायरॉयडिज्म में क्या हो रहा है? द पैराथायरॉयड ग्लैंड में कुछ प्रॉब्लम हो रही है, उसकी वजह से पैराथायरॉयड हार्मोन इज नॉट एबल टू गेट सिक्रीटेड. ठीक है, तो अगर वो सिक्रीट ही नहीं हो रहा है तो वो अपने रिसेप्टर, किसके ऊपर, क्या रिसेप्टर है? द रैंक एंड द रैंक लाइगेंड, उसकी वजह से क्या हो रहा है? द GS अल्फा रिसेप्टर which is present on what? The GS alpha, which is present on the osteoblastic cells, it won't get activated. उसकी वजह से क्या होगा? उसकी वजह से the transcription problem होगी, translation problem होगी. What? The bone forming proteins won't be formed, है ना? And also the osteoclastic activity will be less, and therefore the calcium will be less. Okay, so that is the hypoparathyroidism. So hypoparathyroidism, what is happening? The parathyroid hormone that is less, the calcium level that is less, right? The phosphate, the kidneys are normal, that will increase. The alkaline phosphatase level, that will be normal. So this is what is happening in hypoparathyroidism. Now what is pseudohypoparathyroidism? Pseudohypoparathyroidism का मतलब क्या है? The features, the clinical features are same as that of hypoparathyroidism. Then why is it pseudo? That is because the parathyroid gland and hormone are normal. The parathyroid gland and the hormone are normal. Then what is the problem? The problem is, see, कभी भी calcium is decreasing. उसकी वजह से क्या हो रहा है? Because of the calcium sensing receptors which is present on what? Parathyroid gland, वो activate हो जाते हैं. उसकी वजह से क्या होगा? Parathyroid hormone वो रिलीज तो हो रहा है, इट इज गेटिंग रिलीज्ड, बट रिसेप्टर कहाँ थे? ऑस्टियोब्लास्ट के ऊपर. बट द प्रॉब्लम इज विद द GS alpha. Remember, the problem in the pseudohypothyroid is in the GS alpha. It is GS alpha because of some problem in the gene, that is GNAS gene. ठीक है, उसकी वजह से ये जो GS alpha है उसके ऊपर ये एक्ट नहीं कर पाता. ठीक है, the parathyroid hormone is present but it is not able to act on this receptor. उसकी वजह से क्या होगा, ये जो एडिनाइल साइक्लेज वाला है, ठीक है, वो एक्टिवेट नहीं होगा. उसकी वजह से ATP won't get converted into CAMP. उसकी वजह से क्या होगा, उसकी वजह से बोन फॉर्मिंग प्रोटीन्स बनेंगे नहीं बनेंगे, इट वोंट बी फॉर्म, इट वोंट बी फॉर्म. ऑल्सो इसकी वजह से क्या हो रहा था, ऑस्टियोक्लास्ट फॉर्मिंग फैक्टर्स, एक्टिवेशन फैक्टर्स वर गेटिंग फॉर्म, ये नहीं होगा. उसकी वजह से फ्रॉम द ऑस्टियोक्लास्ट calcium release nahi hoga, so calcium will be less, calcium will be less. So in pseudohypothyroidism kya ho raha hai, hypoparathyroid, the PTH level, what is it, it is normal. Okay, the PTH is normal, the parathyroid gland is normal, but what is the problem, the problem is in the receptor. And therefore what will happen, the osteoclast activating factors वो नहीं फॉर्म होंगे. ठीक है, वो एग्रीगेट नहीं होंगे तो ऑस्टियोक्लास्ट नहीं बनेगा. अल्टीमेटली कैल्शियम विल बी लेस. ओके, द PTH it will be more, right, and here there will be transcription problem and therefore the bone forming proteins won't be formed. और जब bone forming proteins नहीं होगी तो what will happen, there will be Albright's osteodystrophy, Albright's hereditary, I'm so sorry, it is Albright's hereditary osteodystrophy which will be there. ठीक है, so Albright hereditary osteodystrophy, will it be present in case of hypoparathyroidism? No, it is present in case of the pseudohypoparathyroidism. Why? Because the bone forming proteins are not there. So what are the features, the bone forming proteins are not there, तो उसकी वजह से क्या होगा, शॉर्ट मेटाकार्पल होगा, शॉर्ट मेटाटार्सल होगा, there will be short stature and there will be renal facies. But remember, ये जो मेटाकार्पल है short, it is only the fourth and the fifth metacarpal which is involved. ठीक है, तो this will be short. See, it is only the fourth and the fifth metacarpal that is involved. So whenever we are forming the wrist, नॉर्मली क्या होता है, ये नक्कल सारे मेटाकार्पल्स के दिखते हैं. ठीक है, whenever we are, but now these are short, तो इसमें नक्कल्स नहीं दिखेंगे, यहाँ पे डिम्पल्स दिखेंगे. तो नक्कल नक्कल, डिम्पल डिम्पल डिफॉर्मिटी विल बी सीन which is known as the Archibalds. Okay, Archibald sign, which is known as the Archibald sign. Is it clear? Is it clear? So this is Albright's osteodystrophy. Now, so in this, what is happening in pseudohypothyroidism, parathyroidism, what is the PTH? That is normal. In fact, it can be high. Okay, it will be high. The parathyroid, it will be high because the calcium, it is less. It is less. Okay, what about what? Okay, is it clear? Guys, is it clear? Any doubt in this? Okay, what about the phosphate? The phosphate, ठीक है, ये इसमें भी प्रॉब्लम है, बट इट इज ओनली द ऑस्टियोक्लास्ट एंड द बोन फॉर्मिंग प्रोटीन जिसमें प्रॉब्लम है. द किडनीज आर नॉर्मल, सो द phosphate level will also increase. The ALP will be normal. So the clinical, the investigations, it will be same as that of the hypoparathyroidism. ठीक है, ये जो फीचर्स है, it will be same as hypoparathyroidism. Thus the parathyroid hormone will be increased in this case. It will be increased in this case. Now, can I use teriparatide in this? Okay, teriparatide इसके ट्रीटमेंट में नहीं यूज कर सकते. क्यों? पैराथायराइड हार्मोन इन्फ्यूजन्स नहीं यूज कर सकते. क्यों? बिकॉज टेरिपैराटाइड क्या है, ये इसका एनालॉग है, पैराथायराइड हार्मोन का एनालॉग है. तो अगर उसको देंगे भी, प्रॉब्लम कहाँ है, रिसेप्टर के ऊपर. वो रिसेप्टर के ऊपर एक्ट नहीं कर पाएगा, तो हाउ विल इट कॉज द रिलीफ ऑफ द सिम्टम्स. इज इट क्लियर? इज इट क्लियर? नाउ What is pseudo? What is pseudo? Pseudo में क्या होता है, ये जो रिसेप्टर है, ओके, द GS अल्फा रिसेप्टर दैट इज नॉर्मल. अगर GS अल्फा रिसेप्टर नॉर्मल होगा तो उसकी वजह से जो ऑस्टियोक्लास्ट एक्टिवेटिंग फैक्टर है वो भी नॉर्मल होगा. ओके, द ऑस्टियोक्लास्ट एक्टिवेटिंग फैक्टर नॉर्मल होगा तो ऑस्टियोक्लास्टिक एक्टिविटी वो भी नॉर्मल होगी. तो कैल्शियम क्या होगा, इट विल बी नॉर्मल. इट विल बी नॉर्मल. कैल्शियम नॉर्मल होगा तो पैराथायराइड हार्मोन क्या होगा, दैट विल बी नॉर्मल. तो फिर प्रॉब्लम कहाँ है? द प्रॉब्लम इज विद द ट्रांसक्रिप्शन. And because of this transcriptional abnormality from adenyl cyclase से, ठीक है, जो ये ATP से cyclic AMP, the bone forming proteins जो बन रहे थे वो नहीं बनेंगे. And when the bone forming proteins are not formed, this is the problem. उसकी वजह से क्या होगा, we will see Albright's hereditary osteodystrophy features. But what will happen to the calcium and the parathyroid hormone and the phosphate level? That will be normal. ठीक है? Is it clear? So pseudo में only the transcription problem is there. Pseudohypothyroidism, it is the gene which is affecting it. Which is affected. Okay. Now, as I'm telling you, it is Albright's hereditary osteodystrophy. So there is some problem in what? There is some problem with the genomic imprinting. Now, pseudo. There is two P's which is present, so it is because of the paternal genomic imprinting problem. इसमें एक ही P है, so it is maternal. ठीक है? So pseudo में paternal, pseudo में it is maternal. Another important MCQ question. Is it clear? So as I discussed, यहाँ पे revision है, very important question. हाइपोपैराथायरॉइड में क्या है, पैराथायरॉइड हार्मोन रिलीज नहीं हो पा रहा, तो कैल्शियम क्या होगा, इट विल डिक्रीज. उसकी वजह से क्या होगा, द फॉस्फेट इट विल इंक्रीज. आई एम टेलिंग अबाउट द, प्लीज रिमेंबर इट इज आयनाइज्ड. ओके, इट इज द आयनाइज्ड कैल्शियम. ठीक है. द alkaline phosphate it will be normal, the parathyroid hormone it will decrease. Pseudo hypoparathyroid में क्या होगा, pseudo में क्या हो रहा है, there is problem in what, in the GS alpha. The receptor is the problem. So calcium it will decrease, phosphate it will increase, alkaline it will be normal, but the parathyroid hormone it will be normal, or it will in fact, okay, it can increase. Okay, it will be increased. ठीक है. सूडो में क्या होगा, सूडो में ट्रांसक्रिप्शन में प्रॉब्लम है, बोन फॉर्मिंग प्रोटीन में प्रॉब्लम है, मगर ऑस्टियोक्लास्ट वाली जो चीज़ है वो नॉर्मल. So phosphate normal, alkaline phosphatase will be normal, the parathyroid hormone will be normal. So if you see that the calcium is less plus Albright's hereditary osteodystrophy, then what will be your diagnosis? What will be this? If the calcium is less plus these features are present, that means it is pseudohypoparathyroidism. If the calcium is normal plus Albright's hereditary osteodystrophy is present, that means it is pseudohypoparathyroidism. Is it clear? Okay. Now, ये जो GS alpha gene है, ठीक है, ये जो GS alpha receptor है, I'm sorry, it is present on the parathyroid, or it is present on the osteoblast cell, ठीक है, on which the parathyroid hormone acts. ठीक है, this is also responsible for the action of the gonadotropin releasing hormone. तो gonadotropin releasing hormone भी इसी receptor के ऊपर act करते हैं. They also act through G protein coupled receptor, that is GS alpha, the growth hormone releasing and the parathyroid hormone. So whenever there is problem in this, ठीक है, इसमें ही अगर problem है as seen with pseudo hypoparathyroidism, तो पेशेंट को क्या होगा, पैराथायराइड की वजह से डिक्रीज कैल्शियम, इंक्रीज फॉस्फेट एंड ऑल दीज थिंग्स. तो द पेशेंट ग्रोथ, ओके, ग्रोथ रिलीजिंग हार्मोन वो भी कम होगा और गोनाडोट्रोपिन रिलीजिंग हार्मोन भी कम होगा. So, in pseudohypoparathyroidism, Albright's hereditary osteodystrophy, yes, it is present. Is it hormone resistance? The person will be hormonal resistant to multiple hormone resistant, for example, growth hormone, okay, growth releasing hormone, the GnRH, okay, thyroid releasing hormone. Why? Because of the problem in the GS alpha gene. And what will happen? The calcification will be present. There will be basal ganglia calcification which is present. Okay? PPHP, PPHP in pseudo Albright's dystrophy is present, but hormone resistance नहीं होगा क्योंकि the GS alpha is okay. ठीक है, so the patient won't be hormone resistant to all these. Only the problem will be in the bone forming proteins, and the calcification will be seen, but the hormone resistance won't be seen. Is it clear? So guys, today we discussed in detail about the pseudo and the pseudo hypoparathyroidism. And one more thing I want to tell you, the parathyroid hormone, when it is on the low dose, it acts on the osteoblast cell. Okay? And when the parathyroid hormone is given in the high dose, okay, osteoclastic activity, and the action on both this is very important for the bone remodeling. Okay, for the bone remodeling. Okay, so that was all for today's class. Thank you, friends. And on the YouTube we have a channel, Let's Crack NEET PG. Please subscribe to it, and if you like my video, please hit the like button and also the bell icon to get the further notifications tomorrow at 7 p.m. on the special class platform. Remember, special class platform, because tomorrow is Wednesday, that is on 3rd of Feb. We will discuss the other problems of the hypoparathyroidism. ठीक है, what the drugs, कौन से drugs दे सकते हैं, कौन से नहीं दे सकते, ठीक है, how to differentiate it from the other diseases, which is very very important topic. So please follow me on the special class tomorrow, and tomorrow we'll have an important MCQ session and the case scenario session on this topic, on the hypoparathyroidism topic. Use my referral code Apoorva Live to get 10% discount on the Plus and the Iconic subscription. And on the Telegram app, I have a on the Telegram channel, I have a link t.me/Apoorva04 live. You can always subscribe to it, okay, and you can always ask your doubts on this. And also I send you the links for the further classes and also about the schedule. Okay, that was all for today's class. Thank you and have a nice day.